Morning. I'm Missoula Mayor John Engen, and this is our briefing for the 17th of April, believe it or not, 2020. With me this morning, all the way from the Missoula County Board of Commissioners, is Commissioner Juanita Vero. Good morning, Juan. How are you this morning?
Good morning.
And joining us today, we have Nancy DePastino, who is the Suicide Prevention Coordinator for our City County Health Department, and Heather Harp, who represents the 3rd Ward on the Missoula City Council. And these two folks are heading up the Mental Health and Behavioral Health Task Force for what we call COAD, which is the Community Organizations Active in Disaster. We have a lot of acronyms, but these folks are working to make sure that that our hearts and souls are managed and cared for through this COVID-19 crisis. So with that, Commissioner.
Well, thanks so much, and thank you, Nancy and Heather, for being here today. Tell us about the work that you guys are doing in the COAD, and what you and your partners hope to accomplish.
Sure, I'd be happy to. I'm going to just give a real high-level bullet points at this point. We'll probably dive into some of these a little later on, but first and foremost, we've been working on a providers list on our website that helps connect people to the kind of care that they need for both mental and behavioral health. We're partnering with the university and their counseling and social work students, and we're creating a flyer for people without access to the internet so they can still get those same resources that would be found on our website. And last but not least, we're working on the application of the Crisis Now model. What's
the website that you're referencing? Is it the county website, or are you talking about the Your Tomorrow website?
It's covid19.missoula.co. It's the county's website.
Thanks.
So Nancy, tell us a little bit about Crisis Now.
Yeah, the Crisis Now model is really exciting. It's something that we've been working on instituting in Missoula through the Project Tomorrow Montana Suicide Prevention Coalition for a while. And so when this task force came together and all of these people are interested in strengthening our system of care for people in mental health crises, we just decided that we need to dovetail that work together to make sure that we're using this time where we have a sense of urgency to put in place the system we want long-term for Missoulians. And the Crisis Now model is a different way of caring for somebody who's in a mental health crisis. So right now we have, usually uniformed police officers going to check on somebody who might be suicidal, taking them either to a hospital or to jail, which is an inappropriate and inefficient and not effective place for a person in a mental health crisis to be. So the Crisis Now model shifts that. So it's made up of 3 different parts, really. And it's one, a 24/7 National Suicide Prevention Lifeline affiliated call center. So somebody would always be there to take a call for people in Missoula. And right now, our calls are going to Great Falls or Bozeman or elsewhere in the country when somebody calls the Lifeline. So we really want to have a more local call center here. Then the next step would be a mobile crisis unit, which is staffed by a counselor and maybe an EMT person. And those are the people who would go to do a welfare check to see if they can stabilize somebody who's in a mental health crisis, instead of cop cars and uniformed police officers, which can be intimidating and not the most helpful thing for somebody who's panicking or suicidal or any number of different issues. And then those 2 people would try to stabilize the person where they are. And if that can't happen, then the 3rd part of the Crisis Now model is having a kind of a mental health recovery center. It's a more calm setting than a hospital. It is staffed by psychiatrists, counselors, peer support specialists. So people who can really effectively help somebody in a mental health crisis instead of them ending up in our emergency rooms. And our task force is really the whole point of our work right now is to make sure that we're not sending people who are not physically ill to the hospitals. The hospitals can't handle that in a pandemic. So it makes sense to try to shift that right now and work toward the Crisis Now model.
That's great. So we've been doing a couple of things at the city over time. We're trying to train as many of our police officers and first responders in crisis intervention training, so we get out of that box of intimidation or threat.
Right.
And we've certainly seen some success there. And we've also paired a social worker with an officer downtown, and that's been remarkable as well. So I've been working with our Criminal Justice Coordinating Committee on a grant application to support that mobile crisis unit. So with any luck, we'll have something on the ground here before too long. But thank you for that.
Great news, yeah.
Great work.
So with that task force, now who's the audience, or who's your constituency?
Sure, I would say everybody. You know, in the past, I think we've often kind of pigeonholed people with existing mental health issues to try and follow or go to those particular resources. Today is different, and I believe everybody has experienced some form of stress and anxiety that, frankly, we don't know necessarily how to mitigate. And so this entire task force is really trying to respond to that potential need that everyone could actually be able to benefit from just some real basic kind of counseling, just talking to someone else, letting it out. And so that's what we really wanted to do, is just let everybody know that they matter.
Thanks, Heather. So social distancing isn't new to me. People have been avoiding me for the better part of 55 years, but I understand how it might be difficult for others. What are the consequences of social distancing in your estimation?
You know, I think one of my worries about social distancing is that in suicide prevention work, we talk about social isolation and loneliness being a risk factor for suicidal ideation. And so we really need to make sure that people remain connected, and it's going to be new ways, virtually, or, you know, calling your mom, or, you know, whatever it is, but checking in on each other and making sure that people get the services they need. So we do have a lot of resources like 211 to dial if you're, you know, just not sure where to turn for a resource or something like that. And there's always the Suicide Prevention Lifeline, 1-800-273-8255. And we have tons of services that are out there for people. We just need people to make sure that, we need to make sure that people know about them, and that people are checking in on each other.
And I live out in a rural area, and there's perhaps maybe a culture of assumed self-sufficiency, or tough upper lip, or I can take care of myself, or I don't want to bother another person. Can you talk to us about the barriers folks are facing?
Oh, I'm happy to, Juan. I'd say we are our own worst enemy. The fear of showing emotion has crippled families for generations. We have been taught to fight an enemy, but how do you fight the enemy when it's inside of your head or pulsing through your body? And so too many people resort to extreme measures by potentially committing suicide. And families are turned upside down, their worlds are rocked. And this happens because we think we have to figure out the mess on our own. But there's a much better way that we can actually take care of ourselves and our loved ones, and that is through counseling. You know, I often think about how on a daily basis I take 5 milligrams of lisinopril to keep my elevated blood pressure down, and I've been doing that for 15 years, and I don't even think twice about it. Likewise, I see my counselor on a regular basis to keep my mind in check, keep my mind in balance. And as a result, I'm better at handling stress. And so I think in terms of overcoming those barriers to seeking the help that we all need, it is a mindset shift, but it's one that is actually incredibly powering. And the moment that you take that first step, your life is on a better trajectory. And that's what we want to see happen here.
So there are a ton of resources available, and what we've tried to do, I think, is gather those resources in one place. So what kind of help can folks find on the website?
So if you click on the mental and behavioral health section of that website, the covid19.missoula.co, you'll find resources for all kinds of mental health and behavioral health issues. So stress relief to suicide prevention and intervention resources. So we hope people will go check that out. I mean, there's great organizations in Missoula who are doing wonderful things. Western Montana Mental Health Clinic is doing their Dakota House Lifeline is 24/7, and it's 532-8949. You can also text MT to 741-741 if you're more of a texter instead of making a phone call. Sometimes that's easier for people. Then there's like Tamarack Grief Resource Center that has all kinds of stress relieving programs for people to kind of come together. They're doing everything they were doing before, but virtually right now to keep everybody safe. And then Red Willow is another great organization. All their information is on our website, and we have tons more. So there's something for everyone: veterans, people of all abilities. It's a lot of information there, but you'll find your niche somewhere in there.
And so I think, like, tragically, most of us in Montana have known someone who's committed suicide, but I think what you guys are doing are advancing and kind of changing that culture. And I was wondering if you could talk to the services and the movement and the direction for the county that you guys have been able to provide.
Sure.
Those services, yeah.
I'll take the first step here, and then Nancy, if you want to fill in behind me, please do. So on a real personal note, I remember when I finally got to the point that I was ready to seek help. And one of the most maddening steps of dealing with a mental or behavioral health issue is knowing where to turn. And if you think about every profession, whether you're a contractor or insurance agent, you all have specialties. And in the world of counseling, that is no exception. So I remember literally opening up the phone book and trying to figure out which of all these people was the right person to take care of me. And it was really just a real mind-numbing experience. So our very first task that our co-ed task force tackled was to actually create a list of all of our local professionals and be able to sort them out and figure out what kind of insurance that they take, if they're taking new patients, and the demographics that they kind of jive with. And this list, I'm very happy to announce, is going to be shared with that warm line, the hotline, the hospitals, our homeless task force, and even the jail. And it gets that information in the hands of those folks that are going to be advocating for folks to be able to get the help that they need. And I think this is something that should have been done a long time ago, but we're here, and it's going to be a great resource for folks.
Nancy, anything you want to tag on there?
Well, I would just say that the task force has just been a really amazing kind of comprehensive community of people, and we're really working together and making sure we're not duplicating efforts. And I'm thrilled that the work that we're doing right now really is kind of accelerating the work that Project Tomorrow Montana has been working on. There's just so much energy and connection happening right now that we're just kind of turning those wheels faster, which is just, you know, a silver lining, I guess, in all of this.
That's great. So Nancy, make sure that I'm not overstating the case here, but my work with Project Tomorrow, the training I've had in suicide prevention, and my own experience with my physician, for example, you're not going to push someone toward completing suicide by asking them if they're having suicidal thoughts. The opposite is true, right? You can actually prevent through asking that question, and though it's hard, it's a good question to ask.
Absolutely. I'm so glad that you brought this up, because it's a myth that asking somebody about suicide or if they're feeling suicidal puts that idea in their head. It's either in their head or it's not. And if you can directly ask somebody, are you feeling suicidal? There is an exhale of relief, of anxiety, because you are now saying, I understand the depths of your pain. And I understand that sometimes when people feel this low, they might be feeling suicidal. I've seen it happen. I've seen that kind of release happen when you're saying, I really get where you are right now. And then you can start to talk about where they have hope, where it's what might be their lifeline, what might be the thing that was keeping them from killing themselves. And then you get them to, kind of expand on that and keep that kind of more positive spiral going instead of the downward spiral of suicide is the only answer. So we do offer these QPR trainings for free, and we're going to start offering them weekly instead of monthly, virtually. So if you follow the Project Tomorrow Montana Facebook page, we always post those events on there with the Zoom link. And the suicide intervention training QPR stands for question, persuade, refer. And it's really just, it talks to you about suicidal ideation and signs, risks of suicide, and then how to effectively and empathetically listen to somebody to listen their way out of suicide.
That's great.
I'm going to chime in right there. Sorry, Mayor. But I remember when Nancy came to a city council meeting, one of our committee meetings, and talked about the QPR training. And I thought, well, that's kind of intriguing. And I went to one of those training sessions, and I have to say it was so empowering to see members of our community, no matter what social economic group that they were in, that they were all together talking about how a suicide has affected them. And it just kind of charged them up to try and make a difference in this world in a positive direction. And so Nancy, I can't say thank you enough for coming in and speaking to us at one time, but I know your work has been has changed the fabric of our communities. It really has. Thank you.
Thank you.
Well, we are grateful. We're grateful for the work that you're doing. We're grateful for the work the task force is doing, and the many folks who have been engaged in trying to solve for mental and behavioral health in the community for a long time. All these efforts are coming together, and I'm really glad that we have resources for folks who are suffering out there. It's all about tempering that suffering and making lives better. Commissioner, you got anything for us?
No, thank you all so much, and to health and resilience. And I hope everyone has a great weekend.
I'm just going to put this up. You matter. Just remember that. We all matter.
All I see are dots, so I'm going to go.
It says, you matter.
I thought there were balloons for a moment, and then I thought about cake, so that's helpful. Once again, thank you. It's a serious subject, but we got to laugh once in a while. Look forward to chatting with you all on Monday. Be safe, be healthy, and take care of yourselves and each other.